No, that's very helpful to know. And just so, what type of breast reconstruction is right for breast cancer patients? And also, can you go through some of the risks and benefits of each type of breast reconstruction?
Sure. So, everyone is going to be a little bit different, and so the best reconstruction for patient A is going to be different than patient B. And so the way you figure out what's your best options is through a consultation, because during the consultation, the plastic surgeon is going to assess, what your general health is. Do you have any comorbidities? Are you a smoker? Are you a diabetic? Do you have high blood pressure? And then they're going to do a physical exam. And the physical exam allows them to assess a number of things: your breast size, where the nipple position is. Are you a good candidate for a skin-sparing mastectomy or a nipple-sparing mastectomy? And then they're going to examine, your entire body, the abdomen, the thighs, the buttocks, the back, and they're going to look for possible areas where a natural tissue reconstruction or an autologous flap could be performed. And so at the beginning of the consultation, you may have 30 or 40 reconstructions on the table. By the end of the consultation, after all of this is assessed, the plastic surgeon can then narrow down the options that are best for you. And that's when you can kind of get into the nitty gritty. And that's, at this point in the consultation, you should be reviewing before and after photos. So you have an idea of what things are going to look like afterwards, so that expectations are set properly. And then you want to talk about risks and benefits, which gets to your second question. So generally speaking, for post-mastectomy reconstruction is done either with an implant or with your own tissue. And so each one of those categories have general risks and benefits. The advantage of an implant reconstruction is that it's basically a faster surgery. The recovery time is shorter, the surgery is shorter, and so that's certainly an advantage. The disadvantage is that there's a little bit more maintenance with implants. They may not be a permanent device, so you may need to have an implant exchange down the road. If you have a silicone implant placed, the FDA recommends that there's imaging done on that implant roughly every 2 years. You can wait 3 years after it's placed, and then every 2 years after that. The other things that we're concerned about with implants is infection and capsular contracture. So the infection rate is low, but because it's a foreign material, oftentimes when implants do get infected, the only way to clear that infection is to remove the implant. The other thing that I mentioned was capsular contracture, which refers to excess scar tissue that can develop around an implant. So those are the pluses and minuses of implant reconstruction. Natural tissue reconstructions are great because the appearance is often softer and more natural than an implant. There's certainly longevity on your side. Once a natural tissue reconstruction is healed, there's no exchanging it down the road. So it's going to be with you for a lifetime. Disadvantage is that it's a little bit of a longer surgery up front, and the recovery, it's not tremendously longer, but it may be another hour or two in an operating room, and it may be an extra